Hi, I'm Brian Binetti. I am a general and bariatric surgeon in Rhinebeck, New York. I'm the medical director of bariatric surgery at Northern Dutchess Hospital, and I'm here today with my partner, Vadim. Vadim, could you introduce yourself?
Hi, my name is Vadim Meytes. I'm also a general and bariatric surgeon here at Nuvance Health, located in Rhinebeck, New York as well.
We're here to talk today about obesity, and we'll just kind of jump right in. So, Vadim, you've been treating obesity for quite a while now. What is obesity? Is it something that is chronic? Is it something that is simply a matter of willpower? What's kind of behind obesity?
That's a great question. That's actually becoming more and more relevant these days, and I'm learning more and more about it the more people I treat. Obesity is not something simple. It is a very complex chronic disease with multi facets that affect a lot of different symptoms and body systems in the patients that experience this. And our whole approach has been starting to change, where we are treating it as a systemic disease that is chronic in nature, because we've realized all the negative impacts it has on a person's long-term health.
Gotcha. So you and I are surgeons. We tend to treat obesity surgically. So who are the people who qualify for surgery?
So that is a very common question that a lot of our new patients come in wondering who actually does qualify. So at the current time, one of the best tools that we have that is used is something called body mass index. That is a ratio of a person's height to their weight that generates a number. If a person's body mass index is 40 or greater, they will be eligible for surgery. They will also be eligible if their body mass index is 35 or greater and they have another comorbidity such as high blood pressure or diabetes. Anybody that fits those categories will be eligible for surgery.
Gotcha. And how does a patient choose what surgery they get, or is that something that you help them with?
So in our practice, I think both me and you try to work with the patients as a team to figure out what procedure will be best for them. There are multiple procedures that we offer. There is no such thing as a gold standard or one procedure fits all. Every patient, we discuss the pros and cons of each surgery that is offered, and as they work through their process, we make a comprehensive decision on that.
I know there's a lot of different surgical options out there, and you and I provide a bunch of different options. What kinds of things are available at Nuvance Health?
So here at Nuvance Health, we offer truly a comprehensive approach. Not only before people we talk about surgery, we also offer obesity medicine options as well as nutritional assistance. When it comes to surgery, the two most common procedures being offered are a sleeve gastrectomy and a gastric bypass. Those are the two most common procedures being done in this country and as well as at our offices.
Great. So I know a lot of people in the past, we see a lot of patients who have had a gastric band before. We tend not to do so many gastric bands these days. What can we provide or offer patients with gastric bands who have had gastric bands in the past?
Yes, you are right. There are a population of patients out there that still have the gastric band. We welcome all of them into our program. We offer adjustments to the current bands that they have if they want to keep them. And if they are having issues with their bands, we offer removing the band, and then we can talk about what other options are available for conversion.
Great. And then, other patients who have had gastric bypass in the past or sleeve gastrectomy in the past, or maybe some other kind of procedure, do we offer any revisional options for them as well?
So that's also a great point. There are a subset of patients that have had procedures in the past, whether it's with us or other programs, and are now looking either for routine follow-up or they're experiencing some sort of issues. We are more than happy to see those patients as well. And there are definite options that we can discuss with them where we can talk about converting a sleeve into a bypass or revising a bypass if they've already had one.
Gotcha. So I'll kind of change pace a little bit. I know in our practice, we tend to emphasize the importance of lifestyle changes and dietary choices rather than diet. Patients can do, let's say, get started now to help them get healthier and lose weight prior to even starting their weight loss journey through Nuvance Health?
I think that the easiest thing that all of us can probably do a better job of is drink more water. That's very easy. We should all be striving, I think, to drink more water and stay better hydrated. We try to impart that onto our patients right from the start. Looking at food, just focusing more on fiber and protein, and then staying away from starches is a good starting point. However, the specifics of that, we have dietitians that are excellent at kind of breaking down each patient's habits and focusing on them. But the easiest thing, like I said, I think is just increasing water intake and trying to exercise. Even 20 minutes 3 times a week is a good starting point for anyone looking to lose a little bit of weight.
All right, great. And as you know, it's February and it's American Heart Month. And I know you and I have worked with our partners in cardiology to develop a preventative heart health program that includes obesity management. What are some of the links between obesity and heart health, and what can we do to kind of reduce some of those risks that are associated with obesity and cardiovascular health?
So yes, we are working very closely with our cardiology partners because we both our services understand the risk factors of prolonged obesity. The longer that people are carrying extra weight, the longer their hearts are working harder than they should be. And that continuing over months to years will inevitably create heart damage. And this is recognized and it's well publicized that weight and heart health go hand in hand. So hence we did start a joint program between obesity medicine / surgery and cardiology, because we all see the benefit of us working together.
Well, thanks for taking the time today to chat. You can find us on Nuvance Health website and search Bariatrics, but we're happy to see patients both surgically and medically for weight loss. So hope to talk to you guys soon. Take care.
Thanks. All the best.